Hello and welcome to Finding the Root Cause of the Cause. I'm Dr. Dawn Nelson. Quick disclaimer that I do not treat, diagnose, or cure, as well as the AO scan is not a medical device. And these statements have not been evaluated by the FDA. The product is not intended to diagnose, treat, or cure, or prevent any disease. So these are symptoms that people come to me with. I call the Band-Aid effect, where you would take a pain reliever, maybe melatonin to sleep. You want to lose weight, you work out more, you eat less, et cetera, et cetera. We're not really getting to the root cause of why you're having symptoms. We have traditional medicine, we have holistic, and there needs to be a balance. There is a time and place. Example, this man fell, fractured his hip, he's going to need surgery. I don't know about you, but I'd like an anesthesiologist for that. So that's where there's a time and place. With the holistic approach, though, we don't just look at one thing, we look at the entire body, mind, body, and the soul. So some case studies just to share. A client continuously complained of shortness of breath. They went to all the doctors they could. They cleared them and said, everything is fine. Your tests are negative. And after 2 months of me constantly saying, where is the anger? Where is the grief? Which kept showing up under a meridian, we revealed she had unresolved issues with a stepmom for many, many, many years. And we talked it through, and she decided to call that person, thankfully, because they were very elderly in a nursing home, and literally got that off her chest and started feeling much, much better. Another client had stubborn weight gain and fatigue. They wanted to gain muscle and more energy. So her adrenals were showing up, parathyroid. We had some lymph stuck. Just looking at some of the supplements that have come up, and then cilantro, all these things tied together with the hormone panel. And by the way, this is all of the reports that the AO scan offers. I was able, and these are even more, but able to tie it all together for her. That was a lot of stress. The things that weren't happening were causing the weight gain. This client complained, chuckled, because she complained of extreme stomach bloat to the point where she said, I look like I'm 9 months pregnant. And she was older too, and she was thin, but she had that bloat, So parasites showed up, and, most people want to run and go do a parasite cleanse, when really she just needed more acid in her belly. And we had to go through foundations and whatnot to get her there. This client had a routine physical with a regular, doctor, MD. The physician's response was, there are some minor changes in your CBC and ferritin that could represent excess iron storage. And the doctor wanted the client to repeat those tests. The cholesterol, looked great. The remainder of the results were normal. Well, funny story was that the CBC was showing that the client was deficient in B12 and dehydrated, which points to adrenals, low progesterone. Vitamin D was in the normal range. However, in our functional world, it was low, points to the gut, points to hydrochloric acid. Ferritin results were abnormal, high per traditional lab parameters. Again, B12 deficiency, menopausal, which the client was in perimenopause. So where do we start? What do I do? This is an old slide. Ignore dates, ignore things. I've gotten it down to 10 weeks, not 12 now. There is no group at the moment, but there is always able to get access to the AO scan. So anyone who works with me, you will need a subscription for the time we work together. You'll get a free ebook about the scanner. You can go get that right now on YouTube. Just wanted to keep this short and sweet and just say that, it's discipline and it's accountability, and you have to do the work. I can't do it for you. I can coach you. I will coach you through the 10 foundations of wellness. We would meet weekly. And the AO scan, there's tons of training, and nobody taught me. I taught myself based on the trainings that were available to me. There's basic training free that comes with your subscription. Currently, For anyone looking at this video, it is July of 2025, and Solex is offering the subscription without a join-up fee. So you save 49 bucks off the bat. And again, that is a separate requirement from what I offer as far as coaching. So basically, there's two things I offer. It's one-on-one. We meet once a week via Zoom. You will have homework every single week. You also need that subscription, like I said. The other, and I will coach you along the way, right? And that's 10 weeks. The other option is you can either get the subscription or not. You pay me and you give me 7 to 10 business days, and I will scan you. If you have any labs or anything that are recent, I will look at them and review them. Then I compile a report. I send it to you through a HIPAA compliant portal, and that's it. We don't meet, we don't chat, the end. And lastly, you can always just get the scan or yourself and work on yourself without any coaching. So that's what I offer. That's what's available. And I always say, check out the video first, which I hope you, obviously, to get to this point, you would have. And then at this point, if you're like, yes, I have a couple questions and this is the way I want to go, absolutely, we'll keep our appointment, right? That 30 minutes, which usually doesn't take 30. But either way, we'll keep that appointment. But if you're like, this is really not the path I was looking to go down, totally cool. And I get it. Feel free to just cancel your appointment. Just please don't not show, because here's the kicker. If you don't show for your free, the next time you want to do that, then you will get charged before you can schedule. So just a little note there, and hope to see you soon. Have a blessed evening, day, night, whatever time you watch it.